Okay, so one of the really great features of our symposia is that we were able to incorporate the perspectives from the patients who are suffering from the very diseases for which we are trying to find cures. So we're very fortunate today to have Natalie Mendes join us. Natalie has very graciously agreed to discuss her journey as a sufferer of immune thrombocytopenia. Natalie is an educator who originally hails from Calgary, but has a master's in education from the University of British Columbia and has been a Vancouver native for about 2 decades. Is that correct? Okay, great. Natalie, thank you very much for joining us today.
Good morning. I'm grateful to have this opportunity to share my medical journey with you. And I'm also honored to be joining you on the ancestral and unceded territories of the Musqueam, Squamish, and Tsleil-Waututh Nations. My journey began a few decades ago. I woke up one morning and I had this unexplained bruise, which was about 4 inches. It spanned from one side of my waist all the way to the other side of my waist, and I couldn't figure out why. It was possibly from leaning against a table. So I was taken to see a hematologist by my mother, and I was diagnosed with what was called at that time idiopathic thrombocytopenia purpura. And I was put on a very low dose of prednisone, about 5 milligrams, and I did what I could. I researched and did all the research I could to find out what I could do as well. So I avoided contact sports and all the foods that claim to reduce platelets, all the good things like wine, ginger, garlic, chocolate. And then I began to see a local hematologist, Dr. Heather Leach. And so I remained on about 5 milligrams to 15 milligrams of prednisone for a day. So years later, I was bitten by a dog. And this is a picture of my thigh after I healed, and my platelets went dangerously low. So at that time, we started looking into some alternatives, and we contacted the drug health insurance companies. It was just really quite a big process. So the first one that I tried as an alternative, I was still on prednisone at the time, was called Riximio or rituximab. And I was on this for only a couple months. And I did the horizontal lines represent the platelet range. And I got a call late one night from the hematologist at St. Paul's to say that my platelets had gone to down to about 9. So it was recommended that I take 50 milligrams of prednisone. And that almost immediately put me back into the normal zone again. So then my tests became more and more frequent. I had to have more blood tests for my platelets, which I always hated. And the worst part is the anticipation, because I could never tell what the outcome would be. Are they going to be high? Are they going to be low? So I'd just be waiting for the results. And so I was taken off the rituximab, and then we applied for another drug, and that one was eltrombopag. And so I started that in about October 2023, and I was on that for a few months. And then I caught a virus, and then I began to have these chest pains, and they became increasingly worse. And I sort of tried to fluff it off, but eventually it was really unbearable. So I went into the hospital and had so many tests done, and all of them came out to show that my heart was perfectly healthy. There was nothing wrong with me, and I was told that I had stumped the cardiologists. Finally, there was a test that showed my troponin levels were really elevated, and I was diagnosed with myocarditis, and so I was hospitalized. Coincidentally, 2 other people in my community also caught a virus and had heart problems and myocarditis. But I lost a lot of strength that year, and then I was taken off the eltrombopag because it may have possibly contributed to the myocarditis. And again, 50 milligrams of prednisone did the trick, brought me back to a more normal level. Then another morning, I woke up. I also had another virus which affected my lungs. And when I woke up in the morning, I looked in the mirror and my mouth was full of blood. It looked like something on a horror movie, I thought. And I had petechia for the first time all over my chest. So I thought, okay, better go back to St. Paul's. And I was told by the hematologist that I had no discernible platelets. My eyes welled up with tears, and I said, is this it? Am I going to die? How am I still alive on no platelets? And I was assured, no, we have treatments. You can either have, another 50 milligrams of prednisone, or this time it was strongly suggested that I take an IVIG, which I was reluctant to take. But it was strongly advised, so I said, of course, and I was expecting to see this red sack. Instead, it was this white sack. It looked like it was just filled with these sparkly diamonds, and I just remember thinking with each drip how grateful I was to the donor and to have this opportunity to get better and to regain my strength. And it took a lot longer than the prednisone, which I have taken in the past, but it did help me increase my platelet count. So then we looked at another medication, and that was Nplate, romiplastin. So as I began to take it, it was really the first time that a medication had really made a difference to me, and it elevated my platelets for the first time. So they were often above the normal range, and so at that time, I was slowly tapered off the prednisone. However, I experienced a lot of pain, and it was all throughout my body. I just broke my arm. It was about the same amount of pain coming off the prednisone. So Dr. Leach thought maybe it was from being on the prednisone for such a long time and just feeling the after effects of it coming down off of it. I'm so grateful to Dr. Leach and to her medical office assistants, Eunice and Kimberly. They've always advocated for me, and they've always kept me informed right away. And I'm also so grateful for my life. I wake up each morning so happy to be alive. I can't wait to get out of bed every morning. And I'm also grateful to all the doctors who have helped me through this journey. And I want to thank you for the brilliant research that you're doing, and so grateful. Thank you.